Hello everyone, now let us discuss about CPT coding guidelines for surgery, musculoskeletal system part 4. In the current session, we will be focusing on abdomen and shoulder. Now coming to abdomen. Now coming to the first CPT of abdominal session. The first one is 22900, which is nothing but excision, tumor, soft tissue of abdominal wall, subfacial. Example, intramuscular, less than 5 centimeters. And if the tumor size is 5 centimeters or greater than 5 centimeters, you need to report 22901. The next is 22902. Excision, tumor, soft tissue of abdominal wall, subcutaneous, less than 3 centimeters. And if the tumor size is 3 centimeters or greater than 3 centimeters, you need to report 22903. The next is 22904. Radical resection of tumor. Example, sarcoma, soft tissue of abdominal wall, less than 5 centimeters. And when the tumor size is greater than 5 centimeters or 5 centimeters, then you need to report for radical resection of tumor 22905. The next procedure is 22999, which is nothing but unlisted procedure, abdomen musculoskeletal system. Now let us discuss an example. A patient presents with abdominal pain and on ultrasound an intramuscular abdominal wall mass of 3 centimeters was detected. Physician excised the mass, and what is the appropriate CPT for this particular scenario? Here, abdominal wall mass of 3 centimeters was detected and it is intramuscular. So, the appropriate CPT is 22900. Excision, tumor, soft tissue of abdominal wall, subfacial. Example, intramuscular, less than 5 centimeters. Because the mass here is of 3 centimeters, you need to report 22900. Now coming to the CPTs of shoulder. Now we'll discuss about incision CPTs. The first CPT is 23000. Removal of subdeltoid calcareous deposits open. And the next is 23020. Capsular contracture release. Example, severe type procedure. The next is 23030. Incision and drainage shoulder area abscess or hematoma. The next is 23031. Incision and drainage of infected bursa. The next CPT is 23035. Incision bone cortex. For example, in case of osteomyelitis or bone abscess, shoulder area. The next is 23040. Orthotomy glenohumeral joint, including exploration, drainage or removal of foreign body. The next is 23044. Orthotomy acromoclavicular or sternoclavicular joint, including exploration, drainage or removal of foreign body. Now let us discuss about excision CPTs 23065. It deals with biopsy soft tissue of shoulder superficial. So for biopsy of shoulder, you need to report 23065 superficial, and for deep you need to report 23066. The next CPT is 23075. Excision tumor soft tissue of shoulder area subcutaneous less than 3 centimeters, and if the tumor size is greater than 3 centimeters or 3 centimeters, then you need to report 23071. Here it is an out of numerical sequence code, hence it is given by number sign. The next is 23076. Excision tumor soft tissue of shoulder area less than 5 centimeters. Intramuscular. Previously it was subcutaneous. Excision tumor soft tissue of shoulder area intramuscular less than 5 centimeters. You need to report with 23076. And the next CPT, if the tumor size is greater than 5 centimeters or equal to 5 centimeters, then you need to report 23073. This is also out of numerical sequence code. The next CPT is 23077. Radical resection of tumor. Example, sarcoma, soft tissue of shoulder area less than 5 centimeters. If the tumor size is greater than 5 centimeters or equal to 5 centimeters, and for radical resection, you need to report 23078. Radical resection of tumor of soft tissue in shoulder area. The next is 23100. Orthotomy glenohumeral joint including biopsy. The next is 23101. Orthotomy clavicular joint or sternoclavicular joint, including biopsy and or excision of torn cartilage. The next is 23105, orthotomy glenohumeral joint with synovectomy with or without biopsy. The next is 23106, orthotomy sternoclavicular joint with synovectomy with or without biopsy. The next CPT is 23107, orthotomy glenohumeral joint with joint exploration with or without removal of loose or foreign body. The next is 23120, claviculectomy partial. Claviculectomy is nothing but the surgical removal of clavicle. The next is 23125, claviculectomy total. The next CPT is 23130, acrominoplasty or acrominectomy partial with or without coronoacromial ligament release. An acrominoplasty, also known as subacromial decompression, is a surgical procedure that involves the acromion, the triangular shaped bone found in both shoulders. In this orthoscopic procedure, a small piece of bone part is removed to prevent or relieve the friction that develops when the bone comes in contact with the tendon. The next CPT is 23140, excision or curettage of bone cyst or benign tumor of clavicle or scapula. Excision. Next is 23145, excision or curettage of bone cyst or benign tumor of clavicle or scapula with autograft, including obtaining graft. The next CPT is 23146, which is nothing but excision or curettage of bone cyst or benign tumor of clavicle or scapula with allograft. 23145 means with autograft, whereas 23146 means with allograft. The next CPT is 23150, excision or curettage of bone cyst or benign tumor of proximal humerus. With autograft is given by 23155 and with allograft is given by 23156. The next is 23170, sequestrectomy. Example for osteomyelitis or bone abscess clavicle. So the surgical removal of sequestrum is nothing but sequestrectomy. Sequestrectomy is surgical removal of sequestrum. Sequestra is a piece of dead bone that has become separated during the process of necrosis from normal or sound bone. The next is 23172, sequestrectomy, scapula. The next is 23174, sequestrectomy, humerus head to surgical neck. The next is 23180, partial excision, craterization, suturation or diphysectomy bone for clavicle region, partial excision of clavicle. The next is 23182, partial excision, scapula. The next is 23184, partial excision, proximal humerus. The next is 23190, osteectomy of scapula partial. Example, superior medial angle. The next is 23195, resection, humerus head. The next is 23200, radical excision of tumor clavicle. Whereas radical excision of tumor scapula is given by 23210. The next is 23220, radical excision of tumor proximal humerus. The next CPT is 23330, removal of foreign body shoulder subcutaneous. And 23333 is given by removal of foreign body shoulder deep. The next is 23334, removal of prosthesis including debridement and synovectomy when performed, humerus or glenoid component. Humeral or glenoid component. Removal of prosthesis including debridement and synovectomy when performed, humeral or glenoid component is given by 23334. The next is 23335. Removal of prosthesis including debridement and synovectomy when performed, humeral and glenoid components. So both, that means total shoulder. The next is 23350, injection procedure for shoulder orthography or enhanced CT or MRI shoulder orthography. The next CPT is 23395, muscle transfer any type, shoulder or upper arm single. And for multiple muscle transfers, you need to report 23397. The next is 23400, scapulopexy. Scapulopexy is nothing but operative fixation of the scapula to the chest wall or to the spinous process of vertebrae. Opexy means fixation. Next is 23405, tenotomy shoulder area single tendon. Next is 23406, tenotomy shoulder area multiple tendons through same incision. The next is 23410, repair of ruptured musculotendinous cuff. Example, rotator cuff, open acute. Repair of ruptured rotator cuff can be given by 23410, open acute. Next is 23412. 23412 is nothing but repair of ruptured musculotendinous cuff. For example, rotator cuff, open chronic. Previously it was acute. Acute is given by the code 23410, whereas chronic is indicated by 23412. The next is 23415. Coracoacromial ligament release with or without acrominoplasty. The next is 23420. Reconstruction of complete shoulder. Cuff avulsion chronic. Includes acrominoplasty when performed. The next is 23430. Tendordesis of long tendon of biceps. The next is 23440, resection or transplantation of long tendon of biceps. The next is 23450, capsulorrhaphy anterior, putty plat procedure or Magnuson type operation. So capsulorrhaphy is nothing but uraphy means it is derived from the Greek word surgical repair. So surgical repair of capsule. In other words, suture of a cut or wounded capsules. Capsulectomy is given by the code 23450. Capsulectomy anterior. The next CPT is 23455. Capsulorrhaphy with labral repair. Example, Pankart procedure. The next is 23460. Capsulorrhaphy anterior any type with bone block. The next is 23462. Capsulorrhaphy anterior with coracoid process transfer. The next is 23465. Capsulorrhaphy glenohumeral joint posterior with or without bone block. The next is 23466. Capsulorrhaphy glenohumeral joint any type multidirectional instability. The next is 23470, orthoplasty glenohumeral joint, hemiorthoplasty. The next is 23472. Here, total orthoplasty or total shoulder replacement. Example, glenoid and proximal humerus replacement. The next is 23473. Revision of total shoulder orthoplasty, including allograft when performed, humerus or glenoid component. The next is 23474. Revision of total shoulder orthoplasty, including allograft when performed, humerus and glenoid component. The next is 23480. Osteotomy clavicle with or without internal fixation. The next is 23485. Osteotomy clavicle with bone graft of non-union or malunion, including obtaining graft and necessary fixation. The next is 23490. Prophylactic treatment, nailing, pinning, plating and wiring with or without methyl acrylate clavicle. Prophylactic treatment of clavicle is given by 23490. Whereas prophylactic treatment of proximal humerus is given by 23491. The next CPT is 23500. CPTs of fracture and or dislocation. The first one is 23500, which is nothing but closed treatment of clavicular fracture without manipulation. So closed treatment of clavicular fracture with manipulation is given by 23505. The next is 23515. Open treatment of clavicular fracture including internal fixation when performed. Next is 23520. Closed treatment of sternoclavicular dislocation without manipulation. Next is 23525. Closed treatment of sternoclavicular dislocation with the manipulation. Previously 23520 is without manipulation. Next 23525 is with manipulation. The next code is 23530. Open treatment of sternoclavicular dislocation, acute or chronic. The next CPT is 23532, which is nothing but open treatment of sternoclavicular dislocation, acute or chronic, with the facial graft. The next is 23540. Closed treatment of acromioclavicular dislocation without manipulation. The next is 23545. Closed treatment of acromioclavicular dislocation with manipulation. The next is 23550. Open treatment of acromioclavicular dislocation, acute or chronic. The next is 23552. Open treatment of acromioclavicular dislocation, acute or chronic, with facial graft. The next is 23570. Closed treatment of scapular fracture without manipulation. The next code is 23575, which is nothing but closed treatment of scapular fracture with manipulation with or without skeletal traction. Next is 23585. Open treatment of scapular fracture includes internal fixation when performed. Next is 23600. Closed treatment of proximal humerus fracture without manipulation. The next is 23605. Closed treatment of proximal humerus, surgical or anatomical neck fracture with manipulation with or without skeletal traction. The next is 23615. Open treatment of proximal humerus, including internal fixation when performed, includes repair of tuberosity when performed. The next is 23616. Open treatment of proximal humerus fracture, including internal fixation when performed and repair of tuberosity when performed with the proximal humerus prosthetic replacement. The next CPT is 23620. Closed treatment of greater humerus tuberosity fracture without manipulation. With manipulation is given by 23625. The next is 23630. Open treatment of greater humeral tuberosity fracture including internal fixation when performed. The next is 23650. Closed treatment of shoulder dislocation with manipulation without anesthesia. The next is 23655. Closed treatment of shoulder dislocation with manipulation requiring anesthesia. The next is 23660. Open treatment of acute shoulder dislocation. The next CPT is 23665. Closed treatment of shoulder dislocation with fracture of greater humeral tuberosity with manipulation. The next is 23670. Open treatment of shoulder dislocation with fracture of greater humeral tuberosity including internal fixation when performed. The next is 23675. Closed treatment of shoulder dislocation with surgical or anatomical neck fracture with manipulation. The next is 23680. Open treatment of shoulder dislocation with surgical or anatomical neck fracture including internal fixation when performed. The next is 23700. Manipulation under anesthesia shoulder joint including application of fixation apparatus. Now coming to orthodesis, amputation and other procedures. The first CPT is 23800. Orthodesis glenohumeral joint. The next is 23802. Orthodesis glenohumeral joint with autogenous graft. The next is 23900. Interthoracoscapular amputation for quarter. The next is 23920. Disarticulation of shoulder. The next is 23921, secondary closure or scar revision. The next is 23929, unlisted procedure, shoulder. Now let us discuss an example. A 45-year male presents to the operating room with painful mass on the right upper arm. Upon deep dissection of a large mass of 2 cm in the soft tissue of patient's shoulder was noted, and the mass appeared to be benign in nature and with deep blunt dissection and electrocautery. The mass was removed and sent to pathology. What CPT code should be reported here? So mass is in the soft tissue of shoulder and the size is 2 cm. So the appropriate CPT is 20735, which is nothing but excision, tumor, soft tissue of shoulder area, subcutaneous, less than 3 cm. Now let us discuss one more example. A 49-year-old female has 2 previous rotator cuff procedure and now has difficulty in shoulder function, deltoid muscle function, the axillary nerve function. An arthrogram is scheduled. After preparation, the shoulder is anesthetized with 1% lidocaine, 8 cc without epinephrine. The needle was placed into shoulder area posteriorly under the image intensification. It appears as if the dye was in the shoulder joint. She moved with a good return of flow was obtained. The shoulder was then mobilized and there was no evidence of any cuff tear from the posterior arthrogram. What CPT should be reported? So arthrogram means arthrography is performed. So the appropriate CPT is 23350. Injection procedure for shoulder arthrography or enhanced CT or MRI shoulder arthrography. Additionally, 73046 along with 26 to indicate professional component is given for radiological examination, shoulder arthrography, radiological supervision and interpretation. Must be good.